morning. I would like to talk today about the healthcare costs in the Netherlands. I want to go through some data, publicly available data, and show what this data actually means and where are we actually spending healthcare on. To start off with, I have this graph with the healthcare expenditure over time in the Netherlands versus life expectancy. So the pink line is the total healthcare expenditure in the Netherlands in billion euros per year. It starts in 2000 with 45 billion and goes all the way up to 127 billion in 2022. The green line is the life expectancy at birth, and you need to look at the scale there, so from 60 to 100 years. In 2000 it was 78. In 2014 it was 81.6 years was life expectancy at birth. And in 2022 it's the same life expectancy at birth. So from 2014 to 2022 there has not been no increase in life expectancy. However, if you look at the expenditure, it went from 92 billion to 127 billion euros a year. A 40% increase. So we've paid 40% more in health expenditure in the Netherlands, but we didn't get an increase in life expectancy. What did we spend the money on? And is this the best way of spending money within the healthcare sector? So I've looked into the healthcare expenditure in the Netherlands in 2023. This data is slightly different. This is from the health insurance law, the Zorgverzekeringswet. So it's part of the expenditure. And they provided it by age category. So this is the overall expenditure for all people within the age category 0 to 4, 5 to 18, 90 to 44, etc., etc. And this is from 0 to 16 billion euros per year. The first thing you notice is most of the money goes to 45 to 64-year-olds, 13.9 billion. But also between 19 and 84, so also between 19 and 84 is quite a bit of expenditure, with less expenditure in the younger age categories and the 85-year-olds. Then you need to think, how many people are there in this age category? So how much are we spending per person? We're spending it overall most on this age category. But are there the most people in the Dutch population? You can also present this health expenditure per person. So it's adjusted for the population in the Netherlands in 2023. This looks very different from the previous slide. So what is the main thing you notice? There's a bit of expenditure from 0 to 4, it goes down, it goes up. It's not a linear line, but almost an exponential line. So 85-year-old and older, we spend at least 7 times more or 8 times more than the 5 to 18-year-olds. Quite a bit more per person. Even if you look at the 19 to 44, people who are paying their taxes, compared to the 75 to 84, that's also 2.5 times higher expenditure. So quite a large increase in expenditure. If you look from the 45 to 64 to the 75 to 84, that's a 2.5 times increase in expenditure. Quite a significant increase. So this is the data from 2023. I had seen some other data from a little bit older, from 2019. This is a slightly different data source, so this is total healthcare expenditure. If you compare from 85 plus to 95 plus, what do you see? Going really much steeper up. So we're spending a lot of money the last period of someone's life. We didn't get an increased life expectancy for these people. But that's where we're spending money in the Netherlands in 2019. So in 2023, the data was not as detailed, and unfortunately, it's not possible to get this data from the public domain. Going back to the 2023 data, so for the total Dutch population, 2023, you can categorize by the type of expenditure. So we have medical specialists minus expensive pharmaceuticals. This is mainly hospital-related costs. So your medical specialist, so it could be your surgeon, your cardiologist, but also anything in a hospital related. So some of the hospital building, etc. So half our cost goes to hospitals and any care related with hospitals. Only 15% of the budget goes to the pharmaceutical care. So whenever we hear, oh, the pharma industry, they are taking all the money. They're taking 50% of the cut. And pharmaceutical care is not just the pharma industry. It also includes the pharmacists, both in hospital, both in the retail, who make also a salary. So this is not all going to the pharma industry. Medical mental health is 9%. So this is mainly the GGZ, as they call it in the Netherlands, which is related to when you have a mental illness and you might be taken into some sort of mental health clinic. GP, general practitioners, also 9%. Nursing and care relates to nursing homes, but also other care homes, 6%, and other categories are 30%. So anything that's not in here. So really a number to keep in mind, only 15% is going to pharmaceutical care, not just the pharmaceutical industry. So now thinking about, yeah, but how is it then per different age category? As an example, I have the 19 to 44-year-old here on the left, the 75 to 84-year-old on the right. The same categories as in the previous slides. So if we look at the 19 to 44-year-olds, they only have 39% in the medical specialist category. So less hospital-related care. And bear in mind, this pie is smaller than that pie with the values. But medical mental health is 25%. So a quarter of the budget for the 19 to 44-year-olds in 2023 is related to medical mental health. This is a real concern. GPs, 11%, nursing and care, so that some people are in care homes and other categories. And the total pharmaceutical care is 13%. So it's a bit lower than what we saw in the previous slide, but especially this medical mental care, really high, 25%. If we now go to the 75 to 84-year-olds, so 51% medical specialists compared to 39, so more hospital-related care, which you might expect with older people. Pharmaceutical care, 15%, so slightly up. I don't have mental health problems anymore, perhaps, or they're going to the medical specialist for the mental health problems. Nursing and care increases, so people in nursing homes, and it's an elderly population. So that's a huge difference. GPs, it's a larger pie, so they're spending less, relatively less on GP, but the total cost for GPs is still higher than in the other. For 3 of those categories, which you saw on the previous slides, I've put it for all age categories, what are we spending on? And these are the biggest categories. So medical specialists, minus these expensive pharmaceuticals, are the blue ones. And you can see it's a bit from 0 to 4 years old, related to some kids who are in neonatal care and therefore are expensive. Then it goes down and you see it goes up to almost 4,000 euros for the person, and then goes down a little bit in 85 plus. Total pharmaceutical care, you see it goes up and then stabilizes, but the percentage within each category is not too dissimilar. So it's still a relevant expenditure, but it's not a big one. Then the nursing care, if you now look at the nursing care and compare the 75 to 84 and 85 plus, the nursing care goes up, and the hospital, the medical specialist goes down. So people moving to nursing homes, but the overall cost is still larger in the 85 plus versus the 75 plus. So what I've been showing in the last couple of slides is really most of the expenditure in healthcare is in these really elderly people. And it's mainly medical specialists, nursing and care, as well as total pharmaceutical care. So then what can we get out of it? I showed you at the start the life expectancy hadn't really increased from 2014. This is the percentage disabled due to an illness. So you look at every illness can give you some sort of disability. And it might, you're not feeling 100%, but you might feel only 50%. And all your disabilities for a person are added up. So as a person, you can have more than one disability in total. So you might have, if you have like 5 different diseases, you might get up to 1.5. So this is over time, as recorded by health professionals, the percentage of disability a person has in a given year, at a given age category. So health professionals think that 39% of 0 to 4 people have some sort of disability. It's pretty high. Why are they having that high a number? You can give care. And then it goes up. You can say this is related to the healthcare expenditure. So, chicken or egg, is it that they have the disability, they get the additional care? Or is it they get the money and therefore they need to have a label of a disability? This is what the health professionals say. So they think that 95 plus people, they're all sick and they all need high care. If we now look at the self-reported health, so this is this self-perceived health, which is categorized as very good or good. So this is a question, simple question asked to the population, and it's also by age categories, slightly different. But what's interesting, so children, only 4% think they don't have very good or good health. They might have okay health. 75 plus, 60% perceive their health as good or very good. How is this related to the previous graph where I said that almost everyone has perceived to have a disability according to the health professionals? So they perceive that they have good health, but we're still spending a lot of money on it. And if you look at this graph, which is slowly going down in the perceived very good health over time, which is explainable, compared to the increase in money provided to patients, very different story. So are we really getting more health, both in quality, what this is, as well as life expectancy? So to summarize, Most expenditure in healthcare goes to medical specialist care, which includes hospitals, includes all the specialists and all the services that are happening within the hospital setting. Pharmaceutical care, which is pharmaceutical companies as well as the whole industry around it, so the pharmacists and are included, is only 15% of the overall budget. So I'm not certain exactly how much is going to the pharmaceutical industry, but it is less than 15% of the overall budget. Whenever you hear, oh, it's the pharmaceutical company who make all the money, 15% of the budget within the Netherlands in 2023. Most of the money is spent on older people, which goes quite dramatically up. The mental health expenditure is very high in the 19 to 44 age group. It's 25% of their overall expenditure. So we really are concerned about the mental health of our younger population. As I've shown, since 2014, the costs have increased by 40%, but we haven't seen an increase in life expectancy. It remained constant. How can healthcare be better spent to have better outcomes for the Netherlands? This is a question which is a very important topical question across the Western world. How can we spend more optimal? Current spending might not be the case. And at ALM, we're discussing some suggestions for improved healthcare systems. Thank you.